Hi everyone. I'm Dr. Mercedes Okosi with the Coalition for Advancement of Nigerian Mental Health. And this month we're talking about what mental health means to Nigerians. So we've been in the community talking about what those things mean, how people understand mental health and mental illness, and also want to get perspectives from professionals. So we have Dr. Obegolu here with us today, who's a psychiatrist, and I'll let him introduce himself and we'll have a conversation about mental health in the Nigerian community. So tell us a little bit about yourself and the work that you do.
Well, first of all, thank you so much, Dr. Kosi, for the warm introduction, and we appreciate what you do. My name is Dr. Obegolu. I am a medical doctor. My specialty is psychiatry, as Dr. Kosi just stated. I'm an attending physician practicing in the state of New Jersey, and I'm looking forward to helping out with the mental health in the diaspora of the whole world, really. Specifically in Nigeria and Africa as a whole.
Sounds good. Okay. So tell us a little bit about when you're working with your patients in general, but maybe experience with Nigerian and West African population specifically. How do you define mental health and mental illness, and how do you talk about it with the people you see?
I believe mental health is a spectrum. A lot of times we like to believe that mental health is just something that's very vast and very bad and very, big and things like that. It's a spectrum. It can be as severe as, literally psychosis. It could be as little as just anxiety with, trying to overcome certain obstacles in your life, such as maybe taking an exam and things like that. So anything, I would define mental health as anything that keeps you from being able to, work optimally or live your life optimally. Anything that makes you deviate mentally from that is what I would define as mental health.
Yeah. Yeah, I like to think about that too. I like how you defined it as a spectrum. Everyone has a mental health status, where at some points in your life or at some points even during the day, you may be in good mental health in terms of your functioning and mood. And there may be other things that are moments or chronic conditions of mental illness that really impair your functioning. So I think people do
Exactly.
connect around like, how is this impacting my life and what does that mean in terms
E-
of what mental health means?
Exactly. Exactly.
All right. How are, especially as a medical doctor on the psychiatry side, how would you say that mental health and physical health are related, and are they equally important? Is that something comes up in your work?
That's a phenomenal question. So back in the day, growing up and things like that, mental health was not anything that people spoke about. Actually, if you spoke about mental health, it was like, what was wrong with you? Is there something wrong with this individual? It's not something that, people really spoke about, especially being a Nigerian or African male. It's just something that you never thought about because then, when you speak about your emotions or you speak about how you feel, it's you looked up on as, a weaker species or you're not supposed to be doing this, oh, you're not man enough and things like that. So I think that, you know, nowadays, especially with the COVID pandemic, I think it really revealed a lot of things, in the mental aspect world. Um, Mental health is equally as important as physical health, because without your mind, how can you be physical? So I take it very seriously. I think, when I educate my patients, even friends and family and things like that, I let them know the importance of mental health. And it's not just, people say mental health. What is mental health? And what can you do to have a good mental health? Things such as getting adequate sleeping, doing hobbies that you really enjoy. A lot of times people, especially as Africans, we want to work, 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 work. We forget to take that time out, right? To, actually do things that we enjoy. We forget to spend time with our significant others. We forget to spend time with our loved ones and people that are truly important in this world. So that is mental health, realizing that, it's not just about, trying to make money and trying to, get the next house, buy the next car and things like that. It's about cherishing those important moments that we have with our family members and things like that. So that's just as little as mental health. And it can also be as big as, going on trips, a girl's trip or a boy's trip or just any type of trips and things like that. So all these are mental health ways that you can maintain a good mental health. And like I said, it's equally as important as the physical health.
Yeah. Yeah. I think sometimes people don't see it as like equally foundational as your physical health. Of course, your body needs to be healthy, you need physical safety, but also, like you said, some of the other really important aspects of our lives, like sleep and movement and exercise and spending time in community are impacted by and can impact our mental health as well. So thinking of it as like your whole bodily experience also includes your mind. And if your mind is not well, it probably will have an impact in both directions.
Exactly, exactly.
All right. What are some of the ways that you assess for mental health concerns with the patients you see? And are there any symptoms that are less commonly associated with mental health? Like, for example, I know a lot of people, they're starting to integrate mental health care into primary care because people will come in with like, I have uh, this like stomach pain that I can't explain, and it turns out they're really anxious. So what kind of things are
Yeah.
you looking for and assessing?
So as I stated earlier, previously, anything that deviates from the norm of your normal living, I would say is some form of mental health, right? So as a physician, as a practicing physician, psychiatrist, I it's always good to ask questions, right? So it's always good to have an open-minded dialogue with your patients. You don't want to come across as a judgmental person while you're asking questions, right? So I'm very careful in asking the right questions without coming across as being judgmental. More importantly, when I ask certain questions, you want to be targeted exactly what you're asking. For example, if you're trying to, eliminate psychosis, psychosis can present differently for everybody. It's not just a matter of hearing voices or seeing things, it could be something as simple as being paranoid because of your past history and things like that. It could be as simple as PTSD, witnessing traumatic events that happened in your life, such as, witnessing a car accident or a plane crash or something, even though that usually doesn't happen, but that's traumatic. So when I assess my patients, I try to ask um, open-minded questions um, without coming across as judgmental. And as you stated earlier, like, sometimes people present with anxiety, with, stomach pains and things like that, or sweaty palms, or like, shutting down, or even social anxiety, such as like, not being able to go on dates or interacting with people in general. All these are things that, fall under the umbrella of mental health that, we all need to be able to address as a physician, asking the right questions. Um, so that's how I usually come across. I try to be as open-minded as possible. I try to be very accommodating, very welcoming, and also normalizing the stigma. It's not easy for people to come and say, "Hey, there's something going on with me. Is there way you can help me with this?" Especially in the African community. It's like when you go to a psychiatrist, "Hey, what's wrong with you?" "Oh, did you hear about this person? This person is mad. Go to church and things like that." Not saying that church and spiritual realm is not something that can be integrated with the medical aspect, but when there's a psychiatric component, it needs to be addressed directly.
Yeah. Yeah, you bring up a good point about stigma, and that leads to the next question. I think when people don't have the perspective of looking at it as a spectrum, it's either that you're like totally mentally well and nothing's wrong and everything's positive, or like you're stigmatizing kind of words like crazy or mad and like shunned from the community or shamed.
Mhm.
Um, how do you notice that with patients that come to you that maybe were hesitant, and how do you talk to them about facing stigma or shame around mental health topics?
I That's a very good question. I tend to get along and actually get more younger patients come to me and open up to me, maybe because I'm closer to their age as opposed to, older physicians that have been practicing for a very long time. When they look at me, they see themselves reflected in me. So I do things that they like to do, I like to, have fun and things like that. So they're able to relate to me, because they're able to relate to me, it's important for me to also teach them and educate them so that way they can listen, right? So I always try to, educate young people because the problem with mental health is like the longer you let it go, the more problematic it becomes in the future. I'm a firm believer that, once something is, once you find out about a mental health, it's important to kind of nip the bud, from the beginning and things like that. So um, with younger people and things like that, I try to normalize the stigma. Hey, it's okay to talk about this. Hey, you're feeling like this. It's completely okay. You're not the only one that's ever felt like this before. So that's how I try to do it, and it's actually worked for me. Like I said, I'm very, I tend to get along with younger patients and things like that because of the open mindedness of these sensitive topics that I talk about.
Yeah. And I feel like that is changing as people have more like access and are talking more about these topics openly.
Hmm.
That made me think of I work in university mental health and also in private practice. But sometimes,
Yeah.
specifically when you have young adults who are coming to college for the first time and can access the college psychological and counseling center, will be like kids from Nigerian families or other immigrant families who say like, yeah, they told me, don't go to therapy, don't take medication, don't tell people your business, you don't want to look crazy. And now that I'm more independent, I can go to see a psychologist or a psychiatrist for the first time on my own, and like learn that it is okay to talk about these things now before it potentially gets worse if there are no interventions. So I think being that face of someone who can access you and relate to you is definitely important.
Yeah, and just to piggyback on what you said, which is really great, mental health does not discriminate. The thing is like what you feel like you're going through, believe and trust me, a lot of other people are going through exactly the same thing, if not worse. So a lot of times the reason why people feel so ashamed to talk about something is because they feel or they're made to believe that they're the only ones or it's a few people going through what they're going through. But trust and believe there's a lot of people going through exactly what you're going through, if not worse. So again, it's just the normalizing the stigma of mental health.
Yeah. So some culturally specific things, how do you think culture and environment and upbringing impact people's mental health? Or particularly some of the cultural norms and themes that you see in Nigerian families, like you mentioned, some things around how gender is viewed in terms of men talking about their feelings. What other cultural or environmental aspects do you think have a big impact on people's mental health?
Great question. Are you talking about just our culture, Nigerian culture, or just in general?
I guess you can say a little bit generally, and then if you think of specific examples to like Nigerian cultural experiences as well.
What I've actually noticed is that, all our cultures are very similar outside of America, like the Indian family, the Asian family, the Hispanic family. Believe it or not, our culture is actually very, very similar. And it's in the sense that, in our culture specifically, growing up, education was the number one thing. Like it's like if like my father was, beating to me the importance of education when I was like 4 or 5 years old. And I think this is something that we've gotten used to, but it could be mentally detrimental to a young growing person that decides, okay, I don't want to be a doctor, I don't want to be an engineer, I don't want to be a lawyer, I want to pursue a career in art, I want to pursue a career in music and things like that. I think it's, also coming together to, have that acceptance. Like, you don't have to, push your children or certain individuals to do certain things just because that's the belief that you have as a person. Um, for me personally, I don't plan on doing that with my kids. I want my kids to do whatever they want to do. Of course, I will support them. Of course, I would, let them know the importance of education. But I'm not gonna like, luckily my parents didn't do that to me. I'm not gonna tell them, hey, you have to be a doctor or you have to be a pharmacist or you have to do this or whatever. So I think it's just, have again, it comes back to being open minded. That's I guess my word for this interview that we're using, being open minded. And having acceptance for people. Not everyone is the same, Believe it or not, we're all Nigerians or we're all Africans, but individually we're all very, very different. We think differently. And just having that acceptance, whether it's in the Asian community, I've noticed that, in the Asian community, there's different things that are, accepted, culturally accepted that might not be culturally accepted here in the US and vice versa. So it's just, again, being open minded to accepting people's cultural differences and things like that. I think that goes a long way in helping with mental health.
Yeah. Yeah. As you say that, I'm thinking of so many examples of people that I've worked with over the years where and back to your point about our definition of mental health having to do with your functioning, sometimes people will think that like I'm okay as long as I'm like getting good grades or going to work. But I often have to tell people that like your life is not only about work, and your like assessment of your functioning is also about like what are your relationships like? What's your self-concept like? It's not sustainable to like burn yourself out working super hard, but no other areas of your life are functioning well. And I think I found a lot of, like you said, across different immigrant families, you'll have like a kid at an elite university upset and panicking because they got a 95 and not 100 on their exam. And I think that comes from like the some of the fear that immigrant parents have about like how much they invested in their own journey, and then knowing that like, okay, what's our best bet for success for our kid, doctor, lawyer, engineer? If anything else strays from that, like our own emotional investment feels threatened. And so a lot of that can be transferred onto um, uh, the kid of those families, and it is difficult to deal with. Uh,
Exactly.
yeah.
By the way, I was one of those kids. Like I just remember back in college, I've always been a straight A student, but I remember getting a D in statistics, and I thought it was the end of the world, honestly
Oh
speaking,
no.
just because the pressure that I put on my own self, not even my parents, but as when you talk to other medical doctors, medical school does humble you. A B is excellent, actually. Actually, C in medical school is excellent. So like it truly humbles you. So yeah, it's just to piggyback on what you said, it's actually a reality, just the pressure that we put on ourselves, pressure that we get put on by our families and things like that. So yeah.
Yeah. Um, what common misconceptions do you think that people have around mental illness or the topic of mental health in general? We've talked about some of the stigmas, but what other kind of
Yeah.
things do you hear specific to Nigerian communities or a general misconceptions?
Well, the biggest one that comes across my mind right away is just, men,
Mm,
as a Nigerian man, I want to let everybody know looking and watching this interview, it's very okay to express your emotions. Actually, expressing your emotions to other people makes you emotionally strong, actually. It's so easy to hide your emotions, and if you're having issues and feeling a certain way, it's so easy. Anyone can just, keep it to themselves and not say anything or whatever. But you actually saying, hey, this is how I feel about a certain thing, it's not the norm for, at least the world has made it seem like it's not the norm for us men to express our emotions, but actually you're an emotionally intelligent person by just speaking on how you feel and things like that. So that's the biggest elephant in the room that jumps across my head as as you ask me that question. Other ones that I could think about is just like, even for women, like women, nowadays, like they're want to believe that, like there's cultural, oh, a woman has to do this because a woman is supposed to be in the kitchen, stuff like that. I mean,
mm,
granted, there's certain culture that that we go by and things like that. There's certain cultural norms and things like that, but I don't think there's anything set in stone on how people should be or how people should act just because they're wife or just because they're a daughter and things like that. Again, it's removing those, those, I would say, roles or per se that people are in our culture, like children are supposed to do this, or men are supposed to do this, women are supposed to do this. Also a good example is like a parent fighting with a child, like in our culture, it's, oh well, that's my child, I could do whatever, like I could hurt his feelings and things like that, but like this is someone's feeling, like it's be open to communication going both ways. So those are just a few things I have to remember on top of my head that I think or things that are in our culture that are very prevalent that can lead to a detrimental mental health.
yeah. Yeah, like balancing when certain practices and norms can be helpful in terms of structure and meaning and everything, but also existing as a person beyond like the role that you're expected to play and understanding how it impacts you and being flexible. Because everyone, like you have been saying, everyone's a different individual. Last
Exactly.
couple of questions to some practical things. Um, what practices do you think people can use to nurture healthy minds? And particularly as a psychiatrist, what do you find people's attitudes are toward medication for psychiatric issues?
Excellent question. That's a really good question. To answer your first question, what practices do I think people can implement to help with the mental health? I would just say what I do per se, because as a mental health provider, I have to practice what I preach. So I cannot, help other people if I'm not mentally, aligned with myself, right? So the first thing I do, like I don't take work too seriously. So once I get home from work, I don't answer my phone, anything that's work related, unless if it's an emergency, of course, I really try to stay away from, always, being on my phone and things like that, just being in the moment, being present and things like that. I take time out to travel. Traveling is my hobby. So I travel a lot, quite frequently. So that's how I do, solo traveling sometimes with friends, sometimes, with a significant other. Um, so those are things that I do. Also, physical exercise is on top of the list. I think physical exercise is very important because, like, it helps you clear your mind. it helps you forget about, what you're going through just for that moment, while you're still improving your physical health. So I'm a big advocate on working out and things like that. I try to work out at least 4 to 5 times a week, whether it's just as simple as walking or maybe even playing tennis. I play tennis or going to the gym, lifting weights and things like that. So those are things that that I use to implement a good mental health. And to add to that, I forgot to say, but good diet. You have to eat well. I mean, I'm not saying be a perfect, eating person or anything like that. Once in a while you can indulge in your sweet tooth and things like that. But for the most part, just be wary of what you put in your body. I'm a firm believer of it's either you pay now or you pay later. You're gonna pay now by working out, spending money getting good food, or you're gonna pay later by spending money in hospital bills. You get to choose what you want. So I hope that answers that question. The
Yeah.
second question that you asked, or did you want to talk piggyback on that?
No, I think what you said is great in terms of the point being longevity, that there are like you maybe like bigger things you can do, like going on a trip or, things that require tools, but then also the things you can do for longevity and just general self-care.
Hmm.
So some of the things you mentioned too, I also put in practice for myself, like exercise, but also like the regular routines that are self-care to just meet your basic needs, like eating well, sleeping well. Now that it's summer in New York, being able to be outside and in the sun and
Exactly. Yeah.
spending time doing other enjoyable things and just checking in with yourself in terms of what you might need and what you can do to meet your needs, and maybe add other practices like breathing and meditation, those kind of things. So yeah, to the question of medication, what do you find are people's attitudes about that?
Yes. So okay. So it goes both ways. Again, the way I practice is I always like to believe in risks versus benefits, right? For me, I like to always ask myself, what is the benefit of this? And there's different levels of mental health, right? So, for example, if someone comes in with anxiety, they're feeling anxious with, maybe going on a date or something like that, or performing in front of a group of people and things like that. There's certain things that don't require medications, such as adequate breathing, taking deep breaths prior to set activities and things like that. However, I work in acute hospital, so I actually firsthand see acutely psychotic people. I actually see acutely manic people, acutely depressed people, people that are literally have attempted suicide or on the verge of attempted suicide and things like that. So in that realm of medicine, I think that medication is very much needed. It just depends. If someone is acutely psychotic, psychosis, for those that don't know, is anything that's out of touch with reality. People thinking, people are out to get them, or they're hearing voices, or they're seeing things out of touch with reality and things like that. That's a definition of psychosis. And they're not able to function in the society. They're not able to take care of themselves. They're a danger to themselves or a danger to other people. In that aspect, I do believe in medications, to get them back to the baseline. Medications don't always have to be a long-term thing. It doesn't have to be a permanent thing. And it just, it could be something to get you back to your baseline, and also to the work that you do. I believe that it's not just medication alone. Therapy actually works hand in hand with medications. So I
Mhm.
think that, it's not just about, just taking medication, but also talking to a professional therapist that can help you, get over difficult hurdles and things like that. And just because people take medication doesn't mean there's anything wrong with them. I actually know people that work on Wall Street, and they're professionals and millionaires that are on medication. So it doesn't mean that just because you're taking medication, there's something wrong with you or that you can function optimally.
Yeah. Yeah. And that's typically when we refer people to your side in terms of like framing it as another helpful tool alongside psychotherapy and some of the analytic and behavioral interventions that we do that can like help you function where maybe some of the tools we have are not enough alone. Last couple questions. Are there anything that you think of as like Nigerian culturally specific strengths or practices that people can lean on to feel empowered or to feel a sense of health or fulfillment in our communities? Like, for example, I saw something the other day, and I've heard of it before, of like, um, they talked about like the somatic benefits, somatic meaning like bodily feelings and movement for definition purposes. But like the somatic benefits of like rhythmic movement. And of course, like the Nigerians and music are hand in hand. So just
Yeah.
being like in rhythm with other people, with community, with music does something for like your mental health in terms of feeling in sync. But yeah, what other culturally specific things or practices or traditions do you think of in our community that help people feel empowered?
Well, I think that we're already doing it actually. Just by me and you setting up a meeting to talk about this, to shed to light, the issues of mental health in our society, in our culture. I think that we are already, starting that practice of letting people know, listen, it's okay to talk about this and things like that. I must say, as us Nigerians, us Africans, we're very extremely resilient people. It's in our blood. There's a lot of things that we are just cut out for that maybe other people or other cultures cannot be cut out for. But at the same time, it doesn't mean that that we should just solely depend on our mental fortitude, right? So basically, what I'm trying to say is that yes, we're mentally strong, we're very resilient, but it's okay to ask for help. You know, um, this past weekend I went on a hike, with our UIU group, something like that. I was able to meet other people, relate to them, talk to them about different things. Some people do know I'm a physician and some people don't, but like, just the fact that they're able to come to me and talk to me about certain things. I have a few friends that come to me, hey, what do you think about this? This is how I feel about this. Just that alone, it makes me feel good that people are actually able to, talk about these things. So again, just the fact that we're sitting here and we're talking about these practices is something that we're already getting ahead on by talking about things like this. In terms of like body movements and things like that, we love to dance. Everybody knows that Nigerians love to dance. Africans, we love to dance and things like that. It goes back. It's actually a form of exercise as well. When you're sweating and you're sweating everywhere. You're actually exercising. It's actually a cardio that you're doing. It goes back to the exercising thing that I talked about earlier. That makes your body it actually whenever you dance, whenever you're calm and things like that, um whenever you're not in a fight or flight situation, your parasympathetics actually kicks in. That's just your rest and relax system of your body. So anything that keeps your mind from always being on the edge, being anxious, oh, I gotta do this, I gotta go to work by this time, I gotta take care of my family, go out with your girls, go dance, go out with your boys, go have a good time, go to a rooftop, go on hiking and things like that. These are very little things that, I feel like a lot of people feel like it's so little that, a lot of people don't even do it. A lot of times people work from Monday to Friday so much that they don't have energy on the weekend to do other things but to rest, which is good. It's good to rest, but also we need to inculcate the practices of taking care of ourselves by indulging with social activities, being involved in the community, sharing your talents with people. These are all things that actually help you. Me doing this, I don't feel like I feel like I'm only giving my gift to the world, but it also makes me feel good. And that in turn makes me have a balanced mental health, if that makes sense. And just in conclusion, I just wanted to say, like, in life, if you cannot fly, run. If you cannot run, walk, but never at the expense of your mental health. The depth of your imagination is only limited, by the things that you can do in life. So
Yeah. Thank you for that. Yeah, I like what you said about all the different ways that we like already have ways that our community feels connected, and there are ways that we can make even more connections. And just like being able to have that space to start to talk about these things is good. Anything else that you want to add or say to our audience before we end?
Um, well, I wanted to thank you personally for giving us this platform. I think what you're doing is an amazing work. Because it's not for yourself; it's literally for our community. It's for people our age. It's for people that are younger than us, and even for people that are older than us. That can learn. In life, there's no time where you stop learning. So I think that anybody can learn from someone that's older than them or younger than them. And once you have that mindset, I think that it's already the beginning of mental stability.
Yeah.
I can learn from a 5 year old. Honestly speaking. So that's just my mindset on certain things. So it's okay to feel a certain way. It's okay to feel anxious, but what's not okay is keeping silent and expecting things to work out magically.
Yeah. Well, thank you again for your time and your insights. And for our audience, we'll be having more interviews with people across the field and sharing more of our insights about what mental health means to Nigerians. All right.
Thank you, Dr. Kosi. I appreciate you. Thank you.
Yeah.
All right, bye.